1. When designing a CSSD training module on steam sterilization cycle monitoring, which adult learning principle is most important to apply? A. Emphasize rote memorization of parameters. B. Provide hands-on practice with biological and chemical indicators linked to workplace tasks. C. Limit instruction to lecture slides only. D. Avoid relating content to learners' prior experience. 2. The first step in curriculum development for a CSSD competency program is A. Drafting test questions for certification. B. Conducting a needs assessment and job task analysis of CSSD roles. C. Purchasing training equipment. D. Scheduling classroom sessions. 3. Which evaluation method most accurately measures a technician's ability to load an autoclave correctly? A. A multiple-choice written exam on chamber pressure. B. Direct observation using a standardized checklist during a live load cycle. C. A post-course satisfaction survey. D. Counting the number of sterilization cycles run per week. 4. A formative evaluation during a CSSD sterilization course would best include A. Final practical exam only. B. Weekly skills checklists and instructor feedback on tray assembly. C. Annual accreditation report review. D. One-time end-of-course survey. 5. A new technician resists using recommended wrapping techniques. Which mentoring strategy is most effective? A. Issuing a formal reprimand immediately. E. Demonstrating correct wrapping, supervising practice, and providing corrective feedback. C. Assigning independent reading without observation. D. Ignoring the behavior until yearly review. 6. To maintain HIPAA and patient confidentiality during case-based sterilization training, the instructor should A. Use real patient identifiers to increase realism. E. Use de-identified case scenarios and emphasize secure handling of documentation. C. Encourage learners to share full chart details in group discussion. D. Email patient lists to trainees for study. 7. When integrating regulatory compliance, e.g. AAMI, CDC, OSHA, into CSSD curriculum, the best approach is to A. Present each standard in isolation without application examples. B. Map each regulatory requirement to specific daily practices and assessment criteria. C. Omit standards and focus on local customs. D. Assume learners already know the standards. 8. Which instructional method most effectively teaches sterile technique to adult CSSD learners? A. Lecture-only presentation on principles. B. Demonstration followed by deliberate practice with feedback and reflection. C. Reading assignment with no practice. D. A long video without instructor facilitation. 9. The most valid way to assess long-term competency in sterilization for staff is A. One-time higher date orientation test. B. Periodic competency assessments combining observed practice, record review, and indicator pass-fail trends. C. Counting years of experience only. D. Annual anonymous opinion surveys. 10. When communicating change in sterilization policy to a multidisciplinary hospital team, the best initial action is A. Post a policy memo and assume understanding. B. Hold a focused briefing that explains rationale, evidence, required actions, and channels for questions. C. Replace existing policy without announcement. D. Send an overly technical regulatory excerpt with no summary. 11. Which mentoring behavior best supports reflective practice among CSSD technicians? A. Providing solutions without discussion. B. Asking guided reflective questions after observing a sterilization run. C. Avoiding any critique to maintain morale. D. Only providing written feedback months later. 12. For curriculum alignment with accreditation bodies, the most critical element is A. Ensuring the curriculum contains popular topics requested by staff. B. Aligning learning objectives and assessments explicitly with accreditor competencies and standards. C. Minimizing time spent on documentation training. D. Prioritizing cost savings over content coverage. 13. Which evaluation metric most directly indicates sterilization process effectiveness over time? A. Number of staff trained per quarter. B. Trends in biological indicator BI and process challenge device results, plus corrective action logs. C. Trainee satisfaction ratings. E. Length of training sessions. 14. In an adult learning-centered CSSD workshop, learner engagement is best promoted by A. Complex theoretical lectures only. B. Problem-based scenarios where participants troubleshoot sterilizer failures from real incident data. C. Sole reliance on handouts and slides. D. Punitive quizzes for incorrect answers. 15. Which communication technique is most effective during high-stress sterilizer malfunction drills? A. Rapid, unclear instructions to save time. B. Clear, concise, closed-loop communication with predefined role assignments. C. Allowing multiple people to give conflicting verbal commands. D. Waiting until after the drill to communicate roles. 16. A performance-based assessment for sterilization safety should include A. Only written multiple-choice items about policies. B. Observed simulated cycles, proper PPE donning doffing, documentation entry, and emergency response actions. C. Counting the number of pages in the policy manual read. D. Timing how fast a tray can be wrapped without quality checks. 17. Which mentoring practice reduces boundary issues and builds trust in CSSD supervision? A. Sharing confidential patient or staff gossip. B. Setting clear expectations, keeping feedback transparent, and modeling professional behavior. C. Favoring certain mentees publicly. D. Withholding praise to maintain authority. 18. When teaching record-keeping and traceability, the curriculum should require learners to A. Memorize traceability codes without hands-on examples. B. Perform end-to-end traceability exercises using actual instrument sets and documentation systems. C. Skip documentation to focus on cleaning tasks. D. Rely on verbal confirmations only. 19. Which strategy most effectively ensures regulatory compliance for occupational safety in CSSD? A. Providing optional brief safety notes with no demonstrations. B. Embedding OSHA and bloodborne pathogen controls into hands-on drills, PPE competency checks, and incident reporting protocols. C. Leaving safety to individual discretion. D. Only discussing safety during annual meetings. 20. In evaluating the instructional quality of a CSSD course, which data source is least useful? A. Learner performance on practical competency assessments. Direct observation using standardized rubrics. C. Learner self-assessment combined with coaching plans. The color scheme of the training slides. 21. Which feedback approach is most effective when a technician consistently makes packaging errors? A. Publicly reprimanding the technician during shift change. Private, behavior-focused feedback with demonstration, practice opportunities, and follow-up checks. C. Removing the technician from duty without guidance. D. Ignoring the issue to avoid confrontation. 22. To foster self-directed learning among experienced CSSD staff, an educator should A. Assign fixed curricula with no choices. B. Provide modular learning paths, access to evidence-based resources, and opportunities for staff to set learning goals linked to job tasks. C. Only use instructor-led mandatory sessions. D. prevent staff from accessing current guidelines independently. 23. The best method to validate a new sterilization SOP before full implementation is A. Immediate hospital-wide rollout with no pilot testing. E. Pilot testing in a controlled area with competency evaluation, process indicators, and staff feedback loops. C. Announcing it at a staff meeting without testing. D. Assuming it will work because the manual looks complete. 24. When designing assessments for CSSD learners, which principle ensures fairness for diverse adult learners? A. Using only timed high-stakes written tests. E. Offering multiple assessment modalities, observational, practical, written, and reasonable accommodations as needed. C. Allowing only subjective grading by a single evaluator. D. Requiring identical assessments without flexibility. 25. Which communication method best supports continuous quality improvement, CQI, in CSSD? A. Sporadic unrecorded verbal comments about problems. B. Structured interdisciplinary debriefs using data dashboards, root cause analysis, and action plans. C. Emailing a list of problems with no follow-up. D. Keeping CQI discussions within management only. 26. A mentor is preparing a remediation plan for a technician with repeated sterilizer indicator failures. The most effective plan includes A. Immediate termination to prevent liability. B. Root cause coaching, hands-on retraining, observed practice, and measurable reassessment milestones. C. Sending the technician to read the policy document only. D. Leaving the technician to self-correct without support.